Well, good morning, everyone. Welcome to another edition of Health Talk. I'm Peter Christian, and joining us in the studio this morning, Dr. Michelle Proper, and of course, there's John King. Good morning, John.
Hey, good morning, Peter.
Not a doctor yet, but he's working on it.
Far from it.
Michelle, how are you?
Wonderful.
Good. Tell us a little bit about Michelle Proper. Where are you from? How'd you get to Missoula?
Well, first off, I want to thank you for having me on the show. I'm
Sure.
very passionate about what I do,
It's
and
our
I'm
pleasure.
excited to talk about it. The other thing is that I want to thank my patients because they normally get started with treatment at 8 in the morning, and they all change their schedule for me to come in and talk today. So I really want to
nice.
thank them.
Okay.
I myself, I was born in Chicago, and I did my undergraduate at the University of Wisconsin.
I just have people born in Chicago are tough.
Well, I like that attitude.
Okay. Go ahead. Yeah.
So I did my undergraduate at the University of Wisconsin, and I majored in genetics. And then came back to Illinois, and I went to the University of Illinois at Chicago for my medical degree. And I originally wanted to go to medical school to be in family practice. I liked developing those long-term relationships with patients. But during my time there, I found radiation oncology. And it's a really nice specialty because I get to help people through a difficult time in their life and explain options to them, as well as follow up with them after those treatments. And so I still get to develop those long-term relationships with patients.
Okay. I know that one of the reasons you're here is you wanted to clear up some big misconceptions about radiation, because that's what you do every day.
Yeah.
So I interrupted you. You were about to say something else. Go ahead.
Nope, that's it. Well, I did my training at the University of Colorado, and that's where I met my husband, and that's really what brought us out here.
Now, it is proper, right?
Yes, it is proper,
Because
like professional.
You're right. It would be easy to say proper because there's a lot more humor in that.
Yes, there is.
That would be improper.
See, there
We
you
can't go that route.
Anyway, all right.
So tell us a little bit about why radiology, with your background in genetics. So why was that such an interesting lure for you?
I think that there's a lot of really fun technology, and things are constantly changing and new. I really like that aspect of it. And two, again, that patient interaction, getting patients through a difficult time, following up with them, developing those long-term relationships is really important. And so I'm not sure, it's funny how you go through things and serendipity sends you in one direction. But I really love my job over at CMC, and I'm happy that we started radiation there just about 2.5 years ago now.
So for those of us who don't know and think radiation, when I think radiation, I think atomic bomb, right?
Yep.
So what? Tell us exactly kind of what goes on in this process.
Yeah. So one of the misconceptions about radiation is that it's unsafe. And I would say that when it's not planned, it is unsafe. But radiation, when we deliver it in a therapeutic manner for cancer treatments, it's actually very safe and effective. So radiation is really just high energy light waves. So there's this electromagnetic spectrum. Radio waves are on one end. And then
Thank you very much.
the very cool end of the light spectrum.
Yes. On the opposite end, on the nerdy end of the spectrum, is radiation. And by definition, ionizing radiation is enough energy to knock an electron out of orbit. And that's kind of what some of the effects from radiation come from.
Which is changing something, right? At an atomic level, basically.
Exactly.
You're actually changing the component inside of you.
Correct. So the way radiation works is a couple of ways. It works directly on DNA damage. So when those cancer cells go to divide, they can't because their DNA has been damaged. And the other way that radiation works is that most of our cell is comprised of water. And so it splits water and generates a hydroxyl radical, or that free radical you hear about.
Wow.
And those free radicals they cause DNA damage. And again, in the cancer cells that just want to keep dividing, they don't repair that damage.
Now, somebody had to discover how radiation affected cancer cells. So what was it? One of those, eureka, the apple falling on Newton's head, kind of accidental, tripped over. Oh my gosh, I didn't realize this was doing this, or was it something that was focused and intentful?
No, this was a little more serendipity again.
Okay.
The original people that were working with radiation, they could see X-rays. And ultimately, they discovered that if you expose yourself too long to them, it can cause a skin reaction or other problems. And I think that Röntgen was actually one of the first people that tried to define the amount of radiation delivered. And for a lot of times, they were called Röntgen
That's why it's
rays.
measured in his name, right?
Exactly,
Right,
exactly.
right.
So Nowadays, we use the International Scientific Unit of gray, but Roentgen rays were for a long time, and it's Roentgen Society and such.
We do have an important question from Mark. He wondered, since you've been mentioning serendipity, if you think the Cubs will make it to the World Series.
Do I want them to, or do I think they will?
Either or. I think you're free to take this however
I
you
think
want.
they are going to make it. I think, you know what, they're going to go all the way this year after 110 years.
So yeah, the curse of the Bambino.
Yeah.
Oh no, that was
No,
Boston.
the goats, right?
Whatever it was. Anyway, so but aside from that, it wouldn't be proper to talk about that. But seriously, okay. So we're coming up against our first break. So we have 4 phone lines open. If you have a question for Dr. Proper, this is what she does. She works with radiation for cancer, and now are there other ailments that you work on?
Yes, actually, there are benign diseases that we treat with radiation, such as keloids, heterotopic ossificans.
Wait, just say that word again.
Keloids?
No, the second one.
Heterotopic ossificans.
Oh, yeah.
Wow.
That's excess bone formation.
Man.
Heterotopic ossificans.
Yep.
Wow.
Yeah. So
That's a
I guess
new
if
one.
you break it down into the suffixes and roots, I guess it makes
Exactly.
sense, right? Yeah.
Yeah.
So
So
I took word clues in high school.
Yeah.
So there you go. Give me enough time and enough slashes, I can figure out what the word means. Anyway, so we're going to take a little break. If you have a question, our lines are open for Dr. Michelle Proper from Community Medical Center. This is Health Talk. The 721-1290 is our number, or you can ask your question on our Facebook page. We'll be happy to pass that along to Dr. Proper, and we'll be right back. We are back on Talkback. 721-1290 is our number. That's John King. I'm Peter Christian. Dr. Michelle Proper is with us from Community Medical Center. Go.
Well, I was really interested to hear how you're shooting people with these waves, right? Would we shoot out radio waves? We have like a giant tower and all this fancy equipment, and I'm curious if you have like some kind of
We have a
DC
giant
Comics
machine.
light gun or what?
not quite. I like to tell people I do invisible surgery, so you can't see what I do.
Cool.
By the way, she had ninja hands when she said invisible surgery.
Absolutely.
That was pretty fantastic.
Yeah, so we plan it. We do a CT scan to plan the radiation, just like any other CT scan. And then when patients are in the room, the machine kind of moves around them. They stay still. And it's just like any other x-ray. So they will hear the machine kind of buzzing or ticking, but they don't see anything or feel anything. It's not painful. But we give these little doses that build up over time for patients. And they are in the room by themselves, but we can see them and hear them. So if there's any problems, they just wave their hands or say, hey, guys, come back in. So we're readily available for them. But we do give these little doses that build up over time. And the reason why we give the little doses that build up over time is so that the normal tissues can repair if there's any damage from the radiation.
How exact is this? It's not like a scalpel, is it? I mean, can you choose where the wave goes and which atoms it bumps electrons off of? Or are you just kind of showering me with these things
So
and hoping it hits the right spot?
Yes. So some people will say, well, why am I not wearing lead when I'm in the room? All of the protection is done within the machine. So there's a couple of things that we do. One is we choose the angles, and so we can avoid, specifically in breast cancer, if we choose an angle that skims across the chest, we can avoid the lungs and the heart. And then within the machine itself, there are what are called multi-leaf collimators, or MLCs, that come in and out. And so it allows the dose to be more uniform and go where we direct it. In terms of the actual atom level, there are a couple different planning systems. One takes into account averages, and another planning system called Monte Carlo actually sends out electrons and then figures out how those electrons are going to interact. So it's a lot more computer power to use this Monte Carlo. So sometimes we do use this Monte Carlo, and sometimes we use the more generic ones.
Monte Carlo as in gambling.
Yes, yes.
Okay.
Because it's kind of a statistical, where is this electron
I
going
was
to
like,
end
was
up?
this Monty guy that came up with this
That's
method? or what?
it's like counting cards or something.
Yeah,
like that.
exactly.
Okay.
Exactly.
So real quickly, and for those who, are blessed enough not to have had any experience with cancer yet. Okay. Could you explain the difference between radiation therapy and chemotherapy?
Yeah. Radiation therapy is a kind of a local therapy. So it only goes where we aim it. So to the breast or the lung or the liver, depending on where cancer is. And chemotherapy goes, we give it through the IV, and chemotherapy works everywhere in the body. So, but there's a couple of places where chemotherapy doesn't work quite as well, and one of them is in the brain. So there's this blood-brain barrier that's very good at keeping infections out of the brain. It also tends to keep chemotherapy out of the brain. So most of the treatments in the brain nowadays are surgery and radiation, although there are some chemotherapies that do get into the brain.
Is the art of radiology expanding? Are you finding new elements and technologies and uses for this method?
Yeah, so there's always new things in planning as well as in new devices. And a couple of the things that I wanted to highlight, since it was October and Breast Cancer Awareness Month, external beam radiation therapy, which is what I've mostly been talking about, is the most common form of radiation. And in women with breast cancer on the left side, we always worry about the heart. And so at Community Medical Center, we have something called deep inspiratory breath hold, where you take a deep breath in that brings air into the lungs and pushes the heart down and kind of towards the back, which allows us to slide our radiation in easier and decrease any dose to the heart.
How did you discover that? Was that just a common sense sort of thing? And let's try it and see what happens?
You know, I'm not sure how it came about. We definitely do know that our anatomy changes when we're breathing.
Sure.
But part of it requires two things. One, patients have to be able to hold their breath for 10 to 15 seconds at a time. But the other thing is we have to make sure that we're localizing it correctly. So there's a smaller margin of error for us, and we have to make sure that where we're aiming it is better. And as our technology on the machine and our diagnostic on the machine has actually improved, we're better able to target it.
How does the machine even produce the radiology waves? I mean, do you have like uranium in there or what?
Excellent question. So our machines are called linear accelerators, and what they're accelerating is actually an electron. So we actually take an electron and we bend it and then shoot it into a target. And then that target, which generally is tungsten, produces these X-rays or photons. Now, sometimes if we're treating skin cancer, we use the electrons directly. Electrons have a charge, so they don't go very far. But for the most part, we're using those X-rays.
But you talk like you just grab an electron. It's not so easy to get an electron free on its own.
No.
So how are you doing that?
Remember those balls where you put your hands on it and you can, in the science museums, and they're usually purple, and then your hair kind of stands on end. It's that same type of mechanism, almost like static electricity, and that's how we generate electrons. So we actually have an electron gun that shoots off electrons.
I knew they had a gun.
I have a little bit of an experience because my son is a CAT scan tech.
Oh, wonderful.
And he told me about a new machine from, I can't even think of the manufacturer now. But anyway, it was $2 million. And I'm going, oh. So is that pretty standard for what you guys are doing? I mean, and why do they cost so much?
Yeah. So in the diagnostic realm, $2 million might be about the proper amount. But in the therapeutic realm, where we have to use a larger variety of energies, our machines actually cost more than that, if you can believe it.
How big are they?
So our machine is actually about the size of this room.
Okay.
Yes. It's got a false front to it, so the only thing the patients see is kind of what we call the gantry, and that's probably 2 feet by 4 feet by 6 feet long.
I bet it's not probably. She's probably measured it out. She seems like the kind of person that measured it out.
We do like to be precise in radiation.
There you go. Absolutely. Well, we're up against a break. We're still looking. If you have a phone call, if you have a question for Dr. Proper, we'd love to. She's here. It's free. I mean, that's the coolest part. 721-1290 is our number, 1-800-568-5309. Especially if you have some fears about this and some apprehension. Here's somebody who can put those fears to rest because she does it every day. We're going to come right back with more of Health Talk in a moment. Hey, we're back. This is Health Talk. Dr. Michelle Proper joining us from Community Medical Center. Now, one thing we haven't talked about yet that I know that you asked us to really bring up is the relation with obesity to cancers and to recoveries and all. So it affects just about everything, right?
Yes. So obesity not only increases our risk of developing cancer, it increases the chance that we can get side effects from treatments, and it also decreases the effectiveness of some of those side effects and actually can increase mortality from cancer.
Now, is that because the sheer, and please forgive me, but the sheer mass of flesh, because of the excess weight, it's more difficult for the waves to penetrate? Is that correct, or what?
So in terms of radiation therapy, very good idea is that it takes more energy to get to where it needs to go.
Right.
And sometimes that's at the expense of the surface. So in women with breast cancer who are large-breasted, we can see more of those peeling or bad sunburn reactions rather than women who are more petite. Radiation also doesn't like skin folds. And so if we have a lot of skin folds, we can increase that risk of a bad sunburn. In terms of chemotherapy, there's a big debate. Somebody may weigh almost twice as much, but it feels uncomfortable to give them twice as much chemotherapy.
Sure, right.
And so then the problem is, well, are we underdosing them and not treating them appropriately? Or, if we're giving them a lot more, are we actually making it that much harder on their kidneys and such? So in terms of the medical oncology world, giving chemotherapy can be very, very tricky with people who are obese.
When you look at someone that is going to receive radiology treatment, I mean, how much does their own physique go into your measurements about how strong of a dosage, et cetera?
Yeah, so the great question. We have different energies. Some of them are a little lower energies and some of them are higher energies. So definitely patients who are larger, we use the higher energies. And it does play into when I talk to people on an individual level. So for breast cancer patients, my discussion will be different in terms of their risk of developing a bad sunburn if they're overweight versus if they're not.
Now, what are the treatments that you give them when there is a sunburn like that? What happens?
Ultimately, and luckily, time heals everything. But we do have some special creams that help prevent any secondary infection or anything like that.
Okay. So tell me, I ask this of everybody that comes in. When your feet hit the floor in the morning, what motivates you to come to work every day?
Again, those long-term relationships. I want to get patients through their cancer treatment and get them into their follow-up so I can ask them how their kids are doing and have more of a nice relationship with them. But so
it isn't just all about the cancer then, right?
No, it's about the people
right.
more than anything. And on the other hand, there are about a quarter of the patients who get radiation where I give it for pain control. I can't cure them, but I can help make them feel better. And honestly, that has some of the best treatments that I give is to when I get to see patients who are having a lot of bony pain somewhere and I get to give them radiation and then they say, gosh, I'm feeling better already, doc. I'm walking around better, that type of thing.
Okay, we got about a minute. So give us some contact information and what happens when we come in.
Yeah, so I'm over at Community Medical Center. The phone number there is 327-3911. And we have a wonderful front desk staff. They're just the most delightful ladies, and I've had multiple people say how happy they are to come see us.
Now, real quickly, what about insurance? Is it pretty much covered by insurance?
Yes,
it is.
And we always get permission from the insurance companies when we need to so that we don't stick you with a big bill at the end. So
sure.
we have people specifically dedicated towards that.
Okay, that's important.
It is important.
As much as healing is good, it's good not to stress about how you're going to pay for it.
Yes, we worry about their financial, mental, and physical health for
all
our
right,
patients.
so give us the phone number and the location again and how we can contact you.
The location is 2828 Fort Missoula Road, and our phone number is 327-3911.
Been a pleasure. Thank you.
Thank you, guys.
You're a Star Wars hero now. All right, Dr. Michelle Proper from Community Medical Center. That's going to do it for Health Talk, and we will have Talk back on the way in just a few minutes.